doubt your kids can't wait to see what is under the tree this year, right? But before they unwrap all of these gifts, you're definitely going to want to make sure as a parent that they are safe. And here to help us is Dr. Narina Ocampo, a pediatrician with West Boca Medical Center. Thank you so much for being here today. Such a timely topic as we head into the weekend. A lot of toys. Let's start here. Let's start with what is not perhaps a great toy, what maybe not be age appropriate.
Well, when selecting toys for children, parents should really look at the age indications on the box. So this would be appropriate for a child who's 3 or older, not for a 1-year-old. Or
so if you say, well, my child is 2, but they're pretty mature, refrain maybe?
Exactly. These age labels were designed for safety, not for maturity or intelligence levels, but for safety levels.
Because here the concern is for a child under 3, the batteries, the small parts.
The small parts, the batteries, and when looking for a toy with batteries, you want to make sure that the child doesn't have access to the batteries. So this is a perfect toy because there's a little screw. The parents would need to use a screwdriver to open the battery.
You can't just open and close.
Yes.
Love that toy. Also, I noticed you had picked up some crayons earlier. There's an important label that parents should look for.
So parents, when looking for crayons or markers, there's a label at the bottom that should say non-toxic, and it also has this label ASTM, which means they've been tested and they're safe for children to use.
Okay, so something to look for there. You're a pediatrician. I know you see patients all the time. Worst case scenario, you hate to go here, but if a child does get a hold of a toy that's not age appropriate, you've seen some pretty awful things.
Yes, we actually had a patient who ingested a battery and needed to go to the emergency room and needed emergency surgery to remove the battery before it could have caused problems like intestinal obstruction or internal bleeding. So parents really need to be aware of that and to watch for small parts on things that could fall off easily.
And the best thing to do in that case, call 911 right away. Okay. Last minute tips for parents who still have to do some shopping out there. They're looking for the perfect toy, but again, keeping all of these things that we've talked about in mind.
Yeah, basically, again, just looking at labels, making sure things are non-toxic, making sure fabric toys say flame resistant so that they don't catch fire too easily, watching for toys like lasers with lights, not pointing things
this is great stuff.
In somebody's eye, or even playing with a toy gun, just always saying you never point it at anyone, you point it at an object.
Now, are all of these toys going under your tree?
No, my children are too old.
I love this, some good stuff. Doctor, thank you so much. We appreciate you coming in, some great tips there.